Sleep disturbance from shoulder pain is one of the most common complaints I deal with in clinic. 70% of patients with a shoulder problem will report disturbed sleep, and frozen shoulder and rotator cuff repairs are some of the common culprits of this. My top tips for dealing with sleep disturbance from shoulder pain are firstly to make sure and take your painkillers at least half an hour before bedtime, so that they're in your system and help control your pain as you go off to sleep. Sleeping on your back with the affected shoulder supported by a pillow along the arm can also help, as trying to sleep on the unaffected side can cause the affected shoulder to flop forward or backward and cause pain. Some conditions can benefit from icing, so simple over-the-counter ice pack molded over the shoulder 10 to 20 minutes before you go to bed can help relieve pain just as you go off to sleep. Most importantly, however, is to treat the underlying cause. So if your sleep has been disturbed by shoulder pain and this is not settling, it's worth seeing your doctor or a specialist to get a diagnosis so that we can try and treat the underlying cause and get you back to proper sleep.